Hi everybody, I'm Mark McIntosh, and you know, gum disease is a serious problem that is often overlooked, but you can't ignore it. In addition to losing your teeth, it can lead to heart disease and a long list of other medical problems. If you have gum disease, there are questions you should be asking, and right now to answer those questions, we're joined by Dr. Charles Barretts, the owner and senior doctor of Barrett's Dental. He's been practicing dentistry here in Denver for more than 30 years. Good to see you again, Doctor.
Nice to see you, Mark.
Okay, so let's talk about this. How does somebody out there know that they have gum disease?
Well, that's a great question. The answer to that question is pretty simple. Number one, are your gums bleeding? Now, I liken this to fingernails. If you cleaned your fingernails with a fingernail file and your fingernails started bleeding, you would guess something's wrong.
Yeah.
Well, if you're brushing your teeth and your gums bleed, something's wrong. So that's number one. First and foremost, are your gums bleeding?
Okay.
Number two, bad breath. Because gum disease is a bacterial infection, it's kind of like growing a science project in your mouth and kind of like opening a bad Tupperware in the refrigerator that's got bugs growing on it. Doesn't smell real good. Number three, have your teeth started moving lately? If your teeth have started moving and they haven't in the past, there's a good chance that you've got significant gum disease because the supporting bone underneath the gums has probably been eaten away by the acids that the bacteria form, and now the teeth don't have the support that they used to and they start wiggling around. So really, three things: bleeding gums, bad breath, moving teeth that are moving that didn't used to. Those are the typical signs of gum disease.
You know, we mentioned off the top here that having gum disease can lead to some serious dental and health issues, including heart disease, but unpack that a little more for us.
First and foremost, gum disease is the #1 reason adults lose teeth. If your gums and supporting bone are good, there are very few teeth that cannot be saved by using restorative dentistry like crowns, etc. But if your teeth are moving, you can lose them. Even really good teeth can be lost because they have inadequate bony support. So first and foremost, it's the #1 reason adults lose teeth. But in the last 15 years, the impact of gum disease on your body has been exposed tremendously. Heart disease, diabetes, stroke. In women, they can have premature births, which makes it more likely that they can lose their baby. I mean, this is serious business.
Wow. I tell you, let's say that I'm in a situation where I've been told I need to have all my teeth pulled because of gum disease. Is there anything I can do to save them?
Well, the answer to that, Mark, is maybe.
Okay.
Okay, some teeth are just too far gone to be saved. But if they can be saved, yes, what you can do is get a second opinion. There are some dentists out there who take the quick and expeditious approach of pull the teeth and put a patient in dentures. Many of those teeth can be saved with modern periodontal therapy.
But now maybe I'm being told that I need to have gum surgery. Is that the proper procedure? Is there an alternative to it?
Well, the answer is I look at gum surgery for the treatment of disease to be a 20th century approach to treatment of the disease. And there are many doctors who are still stuck in the 20th century doing what I call gum amputation to solve the problem. And yes, it will solve the problem. But with that surgery comes a great deal of pain, a great deal of tooth sensitivity, and that pain and sensitivity lasts for weeks to months. There's a new procedure called LANAP.
Okay.
LANAP stands for Laser Assisted New Attachment Procedure. And instead of amputating the gums and cutting away a significant amount of healthy gum tissue in the process, the laser literally goes in and melts away the diseased tissue. This has been able to allow us to treat teeth that normally would have needed surgery in the past, and technically still do if that's all you do, with a much kinder procedure to the patient. If gum surgery on a scale of 1 to 10 is, let's say, a 9 or a 10 in pain and lasts for about 2 weeks after the surgery, I would, in my opinion, say that the LANAP recovery is only a 2 or 3 on a scale of 1 to 10,
Wow.
and only lasts for 2 or 3 days.
My gosh.
So the impact of the treatment has been dramatically reduced, where people, I had one lady who had gum surgery done on the right side of her mouth and swore that she would never ever have the left side of her mouth treated because she said she would rather lose her teeth than undergo that surgery again.
Wow.
When she heard about this, we treated the left side, and anybody who decides that they want to do LANAP, I will put them in touch with this individual so that they can get a first-hand reference as to how much gum surgery hurts and how much the laser therapy doesn't. So if you're considering it, I'll be happy to hook you up with this individual who can give you firsthand a reference as to how different the 2 procedures are.
Yeah, and give people hope without having to go through all that pain.
We're all about that here.
Yeah. All right. So I've been told I need to have gum surgery. It is probably pretty darn important to get a second opinion before doing that, isn't it?
It's absolutely critical that you get a second opinion. And even if you've been told that you have to lose your teeth, you should get a second opinion. So if you've been told you have to get gum surgery, get a second opinion. Come and see me. I'll do a second opinion at no charge for you. Give you some idea as to whether I believe the laser therapy will be a proper alternative. Give you some idea as to whether I believe your teeth can be saved. We'll then reappoint you and do a proper diagnosis with x-rays and everything else. That's not free, but if you want to get an idea as to whether or not laser gum therapy or LANAP can help you, or whether you can save your teeth, come and see us at Barrett's Dental. We'll take good care of you. We'll give you a free consultation with a second opinion. And there have been times where I've said to the individual, look, you're getting good care. I suggest you stay with your dentist. But there have been many other times where the people have chosen to go with us. And that's certainly what we hope for.
There you go. There you go. Doctor, thank you very much. Appreciate it. All right, for more information or to schedule a free consultation, visit Barrett's Dental at denverdentist.com or just pick up the phone and call 303-731-4153. Now, Barrett's Dental does not accept Medicare or Medicaid. The number one more time, 303-731-4153.